Hello and welcome to Anatomy Physiology Lesson 4.07, Skin Cancer and Other Disorders. So we're going to be talking about skin cancer, decubitus ulcers, and burns. And decubitus ulcers and burns have some similarities, so we'll do those on a separate sheet. So let's start off with skin cancer. What you see here are pictures of melanomas. So this is all the type of cancer known as melanoma. Whoops. And I am off screen, so let me just fix that now. There we go. To start off with, we should point out the other two types of skin cancer are called, so type 1, I'm going to be at the bottom here, is basal cell. And carcino is, oma is tumor, and carcino is cancer. So I think cancer tumor is what it translates to, basal cell carcinoma. And the second type is squamous cell carcinoma. And I think 90% of skin cancers are these two types. So these guys make up 90%. Basal cell starts in the basal cells in the basal layer. And squamous cell is the stratum spinosum. So this would be the stratum basal. These are, again, these make up about 90% of all cancers. 80%, so I think it's like something like 80% are basal cell, and this is the most treatable. It shows up as a brown scaly patch or a sore that won't heal. The basal cells become cancerous, and you begin to see that as it moves up through the epidermis. It doesn't spread super easily. It usually stays contained. I think another 10% are squamous, and this spreads a little bit easier. This needs to be taken care of relatively quickly, or you can end up with a really big pit on your face. My grandpa's got a big chunk off the end of his nose because he had a squamous cell carcinoma. He didn't get it removed quickly. 10% are melanomas, and melanoma is really what you need to be concerned about because melanoma is extremely what we call an aggressive cancer, and it does what is called metastasize. Metastasi. It metastasizes, which means it spreads to other parts of the body. And it's not just in the elderly. When I was in high school, one of our best football players was a linebacker, and he had a mole right where his ear shoulder pad hit his jawline, and he would shave over that mole. So that mole got a lot of irritation. And over the years, between football and shaving, it became cancerous, and it was melanoma. They found it when he was 19, and he died when he was 21. His name was Jim Seifer. If any of you know the Seifers from Pandora, I think they have a scholarship in his name. But understanding what the warning signs are for melanoma, that is good to know at any age. And doctors will say, remember your A, B, C, D, and E's of skin. So benign means not cancerous. So up here we have, this is not cancerous. And malignant means it is cancerous. So A stands for asymmetrical. If you have a mole, and what usually happens is melanoma starts out as a regular mole, and it's like a mole gone bad. So if you have a nice round symmetrical mole and it becomes asymmetrical, so there's my A, that's a warning sign. You can see my borders here. Symmetrical means if I cut it down the middle, I have even left and right halves. If I cut this guy down the middle, ain't no way that's going to be even. Even borders here, I have a nice clean line around this mole. Here, I've got some fuzzy edges here. I've got a strong wavy edge here. These borders are uneven, so B stands for borders. Color, C is color. This is all brown. This is half light brown, half dark brown. We have multiple colors. That's a problem. D is for diameter. Is it smaller than 1/4 of an inch? This has grown to larger than 1/4 of an inch. So D is for diameter. And E is evolving. So this was how the mole started. This is what it looks like now. This mole has changed. It has evolved. There are apps now where you can actually have someone take a picture of your back, and the app will store images of moles on your back, and then you can have that person uh, take pictures like every 6 months or so, and you can see if your moles are changing. But know the ABCDEs of moles, and you'll be able to spot melanoma. That's the best. You're your best advocate here. I do have a family member, and they tend to have a lot of moles in their back, and so they'll see the doctor routinely about every year or every other year. And he's had a couple of moles removed because they were precancerous. That meant they were suspicious. They were concerned about them becoming cancerous. One of the reasons melanoma is so dangerous is because it's aggressive and it metastasizes easily. Remember that basal layer lies right on top of the blood supply, and there's lots of lymph nodes in those areas. And once cancer hits lymph nodes, it can be carried through the body very easily. Cancer likes to hijack a ride in the lymph system. So again, any age. I've had students that have had, we've gone through this lesson and they've shown me a mole, and I said, well, see what your mom and dad say, but maybe it's worth a trip to the doctor. I believe I've had a student that had a mole removed because they thought it was suspicious. So don't wait. All right, I'm going to pause the video to switch slides. All right, so I think this should have been in your note pack. If it's not, don't sweat it. I'll get it to you when I come back. But this is a page that represents decubitus ulcers. And I believe you should have talked about this a few days ago in class. If you didn't, let's just review. A decubitus ulcer occurs when there's pressure. They're sometimes called pressure sores, so they're also known as pressure sores. So when you lie, so if someone's in a nursing home and they're lying on their backs all day, there's pressure. The bone is down here, that's a hard surface, and you have the bed up here, and that could be actually a hard surface. And remember, the epidermis depends on, so we've got the epidermis, we've got the papillary ridges, then we've got all the blood vessels that come up and run here. Probably should do the blood vessels in a different color. So these are the blood vessels. They come up. And they lie here at the junction. If you put pressure on this, it will pinch off this blood supply, and you'll start to have tissue death. The bottom layer of the epidermis will start to die on the top of the dermis, and you begin to get this red spot. If time goes on and the patient isn't turned so that blood can be restored, this deterioration, so here's up here is the epidermis, and down here is the dermis, and then down here is the hypodermis, or the subcutaneous fat. So this is a stage 1, where we begin to have some redness and irritation. If time goes on and the person isn't returned routinely, they'll form an open wound that will go through the whole surface of the dermis. So stage 2 is the epidermis and the dermis. Here we have stage 3. The wound has progressed through the epidermis, all the way through the dermis and into, so now we're down to the hypodermis. Stages 4, we are down into, you can see bone and muscle. So stage 4 is bone and muscle. knew somebody who was in an accident and they became paralyzed. They were in a facility. They weren't turned. They developed a stage 4 decubitus ulcer that was the size of the diameter of the bottom of a drinking glass. And they said there was nothing they could do. They told her to get hospice. Well, she didn't want to just go down without a fight. And so she actually um, said, no, you're going to treat me for this, and demanded treatment. And she's actually come around the other side. And she's regained some of her movement too, I think. But what's interesting is for burns, we stage burns out the same way. So we have, if we burn the integument, we have 1st-degree burns, we have 2nd-degree, and we have 3rd. So 1st-degree usually involves the epidermis, and this is general. So this is the epidermis. 2nd-degree are into the dermis, and 3rd-degree is a full dermis and part of the hypodermis. Hypodermis. These are burns. Oddly enough, 3rd-degree burns really don't hurt all that bad because we've burned away most of the nerves. I don't know if that's true for, I would assume that would be true for decubitus ulcers as well. When you get that deep, the nerves are burned away, you can't feel. Again, another story from a fellow who worked in a factory, and one of the overhead bins of molten steel gave way. It jumped on top of a guy. He did not live. I think he lived about 10, 15 minutes, but he had no pain because the dermis and part of the hypodermis were burned away. So what can they do? They can do what are called skin grafts, where they take tissue grafts and skin grafts, and they can place those into these burned areas or sore areas, and they can promote a healing. They will also put you in an oxygen-rich environment or do a vacuum over the burn or the sore and pump oxygen in to expedite healing. So there's things that they can do for this, but the best course of action is to not end up here in the first place. And if any of you are STNAs, you know that you had to take a lot of training on how to properly turn people so they don't end up with decubitus ulcers. All right, so that takes care of some of the disorders of the integument, cancer, burns, and pressure sores. Thanks for watching, and have a good day.